الحمد لله نحمده ونستعينه ونستغفره ونؤمن به ونتوكل عليه ونعوذ بالله من شرور أنفسنا ومن سيئات أعمالنا من يهده الله فلا مضل له ومن يضلله فلا هادي له ونشهد أن لا إله إلا الله وحده لا شريك له ونشهد أن سيدنا وسندنا وحبيبنا ومولانا محمدا عبده ورسوله صلى الله تبارك وتعالى عليه وعلى آله وصحبه أجمعين. رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. سبحانك لا علم لنا إلا ما علمتنا إنك أنت العليم الحكيم. ربي زدني علما وارزقني فهما. My dear respected listeners, young and old, Assalamu alaikum wa rahmatullahi wa barakatuh, mashallah. Welcome back to a live episode of Your Health, coming to you directly from Iqra Studios here in Bradford, Manchester Road. Alhamdulillah. If you're ever going by, please nip in and say salam to our resident technicians, Adil Saab and Murana Asad Saab, mashallah. It'll be lovely to see you here. We have different things here for purposes of spreading the deen of Allah. So you're more than welcome to come and nip in. You'll find a welcome team here, inshallah. Inshallah ta'ala. Mashallah. I hope you're keeping well. Hope your health is well. I hope your iman is strong, inshallah, and increasing. May Allah ta'ala keep us in his protection, in his afiyat. May Allah ta'ala be pleased with us. Help us do things which are pleasing to Allah subhanahu wa ta'ala. Today's segment is going to be about, inshallah, influenza. Influenza, flu. You have something called the cold and coughs, and then you have something called influenza. Now, what is influenza? What are the symptoms of influenza? What can it do to a person? Can it be serious? Is it just a mild illness that goes by itself? Can people die from influenza? And then, after the symptoms of influenza, I want to tell you the main homeopathic remedies. There's 5 main homeopathic remedies that are really useful for influenzas. Now remember the COVID-19, that was an influenza as well. And alhamdulillah, homeopathic remedies, I found them to be very, very useful for patients with even COVID symptoms, which is a type of flu, alhamdulillah. Now, I'm going to go through the list of 5 main homeopathic remedies, and if you listen carefully and you take notes, one of these remedies or 2 of these remedies you'll find really, really useful for most cases of influenza with all the symptoms, whether it's a runny nose, whether it's a deep hacking cough, whether it's dry, whether it's productive, fevers, muscular aches and pain, and general weaknesses. The symptoms of influenza. So these 5 remedies can be very, very useful. And then inshallah, if you have time, I'll go through a list of 9 other remedies as well. And in between them and a few other things that I mentioned to you, various supplements you can use, should start using now. The people who are elderly, the people who are vulnerable, even the children can use these, just so they don't get the influenza in the first place. Prevention is better than cure. You'd rather not get ill than get ill and then, work through and become better. And when you have influenza, you only realize how important health is when you fall ill. Robust, adults, mazboot people who are strong and robust and healthy, when they fall ill with influenza, life comes to a halt. They don't want to stay in bed all day long, sweating it out with muscular aches and pains. They don't need to do that. They're only doing that because they're in pain. So, inshallah, we'll go through the symptoms and then we will explain to you the remedies. We've got a call waiting. Let's go to the call first of all. Assalamu alaikum wa rahmatullahi wa barakatuh. Okay. As we were saying, the symptoms of influenza are quite severe, and these symptoms can make a person bedbound. 2 days, 3 days, 4 days, 5 days. It's very, very serious. And with some people, especially the young children and the elderly and those with other health conditions, it can prove fatal as well. It can prove fatal. Okay, let's go to the call again. Assalamu alaikum rahmatullahi wa barakatuh. Hello, assalamu alaikum. Hello, assalamu alaikum. Okay, let's continue. As I was saying, so with influenza, first of all, let's talk about what influenza is. Influenza is basically, when you have a upper tract infection, acute upper tract infection. So the signs of that would be you have a right. Okay, let's go to the call again. Assalamu alaikum wa rahmatullahi wa barakatuh. Hello. Acha, I think the caller. We've lost the caller. Koi baat nahi, inshallah. Hopefully, next time they can come through, they can speak, inshallah. So I was saying, influenza. What happens with influenza is when your upper respiratory tract, you have some kind of a virus that's caught hold of you, and that virus starts multiplying, and then you have symptoms. So the first symptom would be maybe a runny nose, or you have a cough. So if someone's got a runny nose, in fact, even before that, the first thing that will happen with influenza is you will feel kind of feverish. The inflammatory stage will happen first. So maybe you've been outside somewhere and you've caught a chill, so you'll feel very, very cold. That will move on to a runny nose. And then the runny nose maybe move on to a cough. Okay, runny nose is going down to the throat. We don't want it to go down to the chest, you see. There's a remedy in homeopathic medicine called aconite. Adil, let the call wait. We'll come back to the call in due course, inshallah. There's a remedy in homeopathic medicine called aconite. Now, aconite is very good. If you take this remedy, aconite, within 24 hours of getting this exposure to cold, then by the grace of Allah, you will not go any further with your cold, and definitely not further with influenza, inshallah. And that remedy is called aconite. Right, let's go back to this call, inshallah. Hello, assalamu alaikum wa rahmatullah.
Wa alaikum salam.
Please, sister.
I rang you last week regarding Citron. I bought that for my mum, and I have read on the ingredient that it has ethanol.
Ethanol.
Inside.
Okay. Did you inquire if that was medical grade ethanol, or was that made from wheat or brandy?
Now, this is what I don't know. That's why I've called back to ask you, because to my knowledge, ethanol is actual like alcohol and not the synthetic form of it.
Okay.
Because I don't know, that's why I'm calling you.
Fine. I don't know either, madam. But what we'll do is, inshallah ta'ala, is I'll ring the company on Monday. I'll get one of the ladies to ring up the company, and we'll find out if it's pure alcohol, it's haram. Okay, unless it's like your life-threatening issue, and then there's no other alternatives. If it's pure alcohol, which is made from these things, from wheat or from barley, or if it's made from dried dates, raisins, then it's haram. Okay, or brandy. So inshallah, ring back next Friday. We'll have your answer for you, inshallah. Is that okay? In the meantime, don't take Citron. Take something else. There's plenty of other things you can take.
So what can I take? That's the second. If that was the case, then it's not. But I will call you next week.
If you take something called yes, there is, of course there is. There's something which is called iron biglycinate. It comes in capsules. Iron biglycinate. That's very, very effective. It's non-cramping. It's non-constipating. That's and it's very, very easily absorbable, even though it's not a liquid. Though if you make a note of something called iron biglycinate, it's a bahut hi fayda hoga. I think it comes in 25 mgs also. Company called Solga does this, and it's very, very good. With normal ferrous fumarate, ferrous gluconate, ferrous sulfate, iron tablets you get from your GP, they cause constipation and they cause cramping. This biglycinate will not do that.
Excellent. I'll call you again next week, and Jazakallah for that.
Okay. Jazakallah. Thank you very much, sister. Assalamu alaikum wa rahmatullah. Though we were saying regarding the flu, so what is a flu and influenza? Influenza lasts a lot longer than a cold. With a cold, you have runny nose, maybe a slight cough, and that's it. It kind of passes. When it doesn't pass, and alongside these symptoms of a runny nose and a cough, when you start developing a fever, you start getting feverish, 37.6 se upar, if your fever goes higher, that's one of the first symptoms of flu, influenza. And number two, and influenza, truth be told, if you remember the 17, 18, 2019, 17, 19, 18, where so many people died, yeah, the Spanish flu, so many people died in the UK, so many people because of influenza. And even every year, if you do the Google search, you'll see how many elderly people die of influenza. It's incredible. So just we say it's a flu. It's not just a flu, especially for people who are young, especially for the people who are elderly, and especially for people who are already ill with other illnesses, and especially when they get secondary infections like pneumonia. Most elderly people, when they go to hospital, they catch a pneumonia and they do not come out of hospital because of falling ill. So as much as you can, you need to keep your elderly people away from hospital, you know. And so if they go in with a cough, cold, and potential bronchitis, pneumonia, bronchiolitis, it's very, very dangerous for them. And we're going to mention things you can do to keep the immune system strong. So you need to start now, from today, all the way till kind of March, April, and keep your immune system boosted. And one of the main things for that I'll mention here now on presently is something called echinacea. Echinacea is it boosts the white cell count. It boosts the white cell count. It makes your immune system more strong. It can fight infections. It's very, very powerful. So echinacea tincture, echinacea extract, alcohol-free. You get this, have 10 drops in the morning, 10 in the evening, give it to the children, give it to the elderly, keep giving it to them. Iske zariye, so many illnesses will go with echinacea. People have hay fever symptoms, perennial hay fever. They have always coughs and colds. They have laryngitis, pharyngitis, sore throats. They have tonsils which are swollen. They can't breathe properly because of adenoids and nasal polyps. Echinacea will wipe out all these symptoms and it'll make your health a lot stronger. So remember, echinacea, this is a very, very good immune boosting herb. Echinacea, you can get this from health food shops, and make sure there's two varieties. You need to get the echinacea, which is good for the immune system, not the other echinacea. So when you do go to the health food shop, if you ask the person there to give you the right echinacea, the one that's good for for infection. So echinacea purpurea is known as P-U-R-P-U-R-E-A, echinacea purpurea. Get that one. Don't get the echinacea angustifolia. You don't want to get echinacea angustifolia. Get the echinacea that begins with the E, and the second part of it is purpurea. Get that one. And you will realize, if you don't do anything else, just get this echinacea, by the grace of Allah, you won't fall prey to influenzas or even colds, inshallah ta'ala. That's the first thing. बस मैं यही बता रहा था कि ज़ाहिर बात है सर्दी का मौसम शुरू हो गया है और बहुत सर्दी है, और सर्दी इससे भी ज़्यादा बढ़ने वाली है. तो अमूमन क्या होता है, जिस तरह के चंद साल पहले भी और हर साल बल्कि होता रहता है, काफ़ी सारी वायरस फिरती रहती हैं, स्पेशली जब हम अंदर होते हैं, घर के अंदर होते हैं, गर्मी होती है, इकट्ठे लोग होते हैं, विंडे वगैरह यानी कि बंद रहते हैं, तो वायरसेस फिरते हैं, और जिस कोई किस्मत के अंदर आ जाता है वो बीमार हो जाते हैं. आदमी को इन्फ्लुएंजा हो जाता है. एक है ठंड, नज़ला, ज़ुकाम, और एक है इससे बढ़कर इन्फ्लुएंजा. तो इसके अंदर काफ़ी फ़र्क है. जो ठंड होती है या नज़ला कहिए, उनकी जो सिम्टम्स होते हैं सिर्फ नाक तक महदूद रहते हैं, या ज़्यादा से ज़्यादा आदमी को खांसी आती है और फिर ख़त्म हो जाते हैं. जब आदमी को इन्फ्लुएंजा होता है तो आदमी का नाक के साथ पानी भी आता बहता रहता है, कभी बंद कभी खुला रहता है, पानी आता है, खांसी होती है. खांसी के साथ आदमी का जो टेम्परेचर है वो बढ़ जाता है. इसके बाद आदमी के जो फट्टे हैं और जोर हैं वहाँ बहुत तकलीफ़ होती है, और इसके साथ साथ आदमी को कमज़ोरी महसूस होती है. इतनी कमज़ोरी कि आदमी बिस्तर से नहीं उठ पाता. ठीक ठाक मजबूत तरीन जवान इंसान बिस्तर से नहीं उठ पाते इस इन्फ्लुएंजा की वजह से. और बाज़ जो है बच्चे होते हैं वो ताप नहीं पा सकते, और उनको ये इन्फ्लुएंजा उनकी मौत की वजह सबब बन जाता है. छोटे बच्चे भी, और स्पेशली जो एल्डरली लोग होते हैं, और लोग जो होते हैं जिनको और बीमारियां होती हैं, क्रॉनिक डिजीज़ होती हैं, तो उनको भी इस इन्फ्लुएंजा की वजह से, क्योंकि उनके डिफेंस कमज़ोर हो जाते हैं ना फ्लू के वायरस की वजह से, तो और सेकेंडरी इन्फेक्शन उनको लग जाते हैं, जिस तरह के बैक्टीरिया वाले इन्फेक्शन, नमोनिया वगैरह. तो इन्फ्लुएंजा ख़तरनाक है, तो बहुत ख्याल करना चाहिए. आदमी आप में को गर्म रहना चाहिए. जब बाहर जाए तो अच्छी तरह आपने आपको यू खुब योरसेल्फ प्रॉब्ली सुबह के वक्त गर्म पानी पीना चाहिए. 2 ग्लासेस ऑफ गर्म पानी, उसके अंदर आप यानी लेमन, नींबू वगैरह जूस डाल दें, आधा नींबू, और आप अच्छी तरह पिएँ. सिस्टम मजबूत रहेगी इंशाअल्लाह ताला, आदमी को ठंड नज़र ज़ुकाम नहीं रहेगा। जब आप बाहर जाए तो ज़ाहिर बात है अच्छे कपड़े पहने, मजबूत कपड़े पहने, मेक श्योर यू डोंट गो आउटसाइड विदाउट योर सॉक्स ऑन, यू वेयर योर सॉक्स, कीप योरसेल्फ वार्म एंड इंशाअल्लाह यू विल बी सेफ फ्रॉम इन्फ्लुएंजा। मैं यही कह रहा था कि एक हर्बल मेडिसिन है जिसका नाम है एक्किनेजिया पर्पुरिया, एक्किनेजिया पर्पुरिया। तो ये जो दवाई है ये बहुत मज़बूत और मुफीद तरीन दवाई है ठंड और नज़ला और ज़ुकाम को, यानी आदमी को न लगे। प्रोफिलैक्टिक एक्शन इसका होता है कि आदमी को शुरू से ये बीमारी लग ही ना जाए, ये नहीं कि आदमी को लगे फिर आदमी उसका इलाज करे। बेहतर ये कि वो बीमारी आदमी को न लगे। उस दवाई का नाम है एक्किनेजिया पर्पुरिया। ये यानी कि लिक्विड होता है, छोटी सी बोतल होती है, 8-9 पाउंड की हो जाती है। तो आदमी ये ले और जितने भी अफराद घर के अंदर, चाहे छोटे हो चाहे बहुत यानी मुअम्मर हो, उन स्पेशली इन हजरात को 10 ड्रॉप्स सुबह पानी के अंदर डालकर और 10 शाम के अंदर डालकर उनको ये आदमी देते जाए। क्योंकि ये जो इन्फ्लुएंजा होती है बहुत ज़्यादा मुअम्मर हजरात बीमार हो जाते हैं इन्फ्लुएंजा से। इन्फ्लुएंजा भर जाती है और फिर सेकेंडरी कॉम्प्लिकेशंस हो जाते हैं और फिर बैक्टीरिया। इन्फ्लुएंजा वायरल इन्फेक्शन होती है, वायरल बीमारी जिस पर एंटीबायोटिक काम नहीं कर पाते, उसके लिए यानी इम्यून सिस्टम का मसला होता है। लेकिन ये कभी भर जाते हैं और जिस्म को कमज़ोर कर लेते हैं, और जब जिस्म कमज़ोर होता है तो फिर आदमी को बैक्टीरियल इन्फेक्शन लग जाता है नमोनिया की तरह, और फिर नमोनिया जब बढ़ जाता है आदमी को फिर खांसी बढ़ जाती है, अंदर ये जो आदमी के जो फेफड़े होते हैं वो ख़राब हो जाते हैं, लंग्स ख़राब हो जाते हैं, आदमी के ऑक्सीजन लेवल गिर जाते हैं, फीवर हाई हो जाता है, तो मेडिकल इमरजेंसी हो जाती है, आदमी अस्पताल जाता है। और फिर अस्पताल से यानी अमूमन आदमी को और बैक्टीरिया की वजह से आदमी और बीमार हो जाता है। MRSA एक बीमारी है, मल्टी ड्रग रेजिस्टेंट स्टेफिलोकोकस ऑरियस, MRSA। तो आदमी बहुत बीमार हो जाता है और बसा औकात आदमी दुनिया से चल बसता है। तो इट्स वेरी इंपॉर्टेंट टू कीप आवर एल्डरली अवे फ्रॉम हॉस्पिटल्स। हॉस्पिटल्स अनफॉर्चुनेटली are kind of really breeding grounds for bacteria, and that's a fact. MRSA, that's where it came from. Which I mentioned, they have nothing for. Multi-drug resistant Staphylococcus aureus, MRSA, is very, very dangerous. So it's best to make sure your immune system is strong and you don't succumb in the first place. And many people don't know about this, that they can use herbs like Echinacea purpurea to keep the immune system strong. Number one. Number two, they can also use things like, zinc pycnolate. Zinc pycnolate is so effective. So many studies have been, these things I mentioned to you, if you Google them and look in PubMed and these research tools, you'll see there's so many countless trials which have proven that these are so effective. Number two, you can take things like zinc pycnolate. Zinc pycnolate is very, very effective. You should take it daily, 15 milligrams or 30 milligrams twice a day, every single day. And if you become ill and you have a respiratory tract infection, or indeed if you have influenza, you can increase that dose 3 times to 45 mg of zinc pycnolate. Alongside that, if you can get hold of some magnesium ascorbate. Magnesium ascorbate is a form of vitamin C. Vitamin C has benefited patients with respiratory tract infections, with the pneumonias, with so many illnesses, intravenously, orally, whichever way that people take it, is very, very beneficial. So you should be taking, if you're concerned about your health or the health of your loved ones, they should be taking, and you should be encouraging them to take 2 grams of magnesium ascorbate daily. Zinc pycnolate, 15 mgs twice a day, 30 mgs. Calcium ascorbate or magnesium ascorbate, which has buffered forms of vitamin C, you can take a lot more of. If you take a normal 99 pence vitamin C from the Morrisons, etc., if you take more than 1 gram, you start getting diarrhea, because they're very astringent and they will cause irritation to your stomach and you will get diarrhea. But you need to take a lot more of the vitamin C's, and the only way you can take more vitamin C's is to get these magnesium ascorbates or calcium ascorbates, which are buffered forms of vitamin C, which you can take a lot more after taking 12-13 grams. I've given to patients 13-14 grams, and by the grace of Allah, the illnesses they go very quickly. So try this, zinc pycnolate and then calcium ascorbate. And the third thing you need to find out is your vitamin D level. We've done a program on this not so long ago. Vitamin D is so important. A study published last week tells us that people with low vitamin D's die a lot more quickly because of all-cause mortality than those who have higher vitamin D serum levels. I say that again, people who have low vitamin D will die much more quickly than anybody else due to any cause mortality for any reason, because vitamin D is so important. So vitamin D needs to be really optimum, not just that you are not deficient. No, you should be therapeutically, high in vitamin D. So these three things are very important, and the first thing I mentioned was taking echinacea. अब चलते हैं towards the homeopathic remedies for influenza. And what you can also do every single day is make sure you take a good multivitamin every single day. In fact, you can take it twice a day, in the morning with breakfast and maybe 1 o'clock with lunch. It'll really boost your health. So now that we know what influenza is, I'll just quickly repeat that. Influenza is when you get an upper respiratory tract infection that then moves on maybe to the chest, and you get symptoms like, first of all, a runny nose. A runny nose goes into a dry hacking cough or maybe a productive cough, which then leads to a fever, which indicates that that upper respiratory tract infection is spreading out to the body. You get a fever, and then you get, after a fever, you get muscular aches and pains, and these vary from severe pains to not so severe. And the third thing is weakness. These are the 5 symptoms of influenza. We're going to go for a short break, inshallah. Stay with us until after the break, and after the break we are going to go through the 5 main homeopathic remedies for influenza. Inshallah, you'll find these very beneficial. If you take notes, no problem at all, inshallah, and get hold of these 5 remedies, आपको बहुत ही ज़्यादा फ़ायदा होगा. Until after the break, assalamu alaikum wa rahmatullahi wa barakatuh.